Hello and welcome to Back to Action Chiropractic, and welcome to the spinal rejuvenation therapy class. Dr. Steve Wilson, I'm from Back to Action Chiropractic. Thank you so much for taking 45 minutes out of a busy day. I know everybody's got a lot going on, but we want to make this well worth your while and really give you a lot of information to help you regain your health. I know when I was younger, I did not know how to take care of my body. I was not very healthy. I was actually sick. I was not sleeping well. I had some stomach issues. I was overweight, not working out because it hurt, and I didn't know how to really work out and eat healthy, how to take care of my body the way it should be. So I hope that you get a lot of good information out of this and learn a little bit more about how to empower yourself to be healthier, happier, and ready to take on next steps. So before we get even started with the slideshow, how many people think that it's possible to live a life free of sickness, disease, and debilitating effects of arthritis? I know it sounds too good to be true, but that's what we're going to be talking about today. We're here to show you the keys to staying young and healthy for the rest of your life. So let's get right to it. Now, World Health Organization, I know everybody's heard of them. They studied over 100 healthcare systems of the industrialized world to see where these different countries were really doing they were doing well, where they were ranking. So where out of the top 100 do you think the United States ranks in saving lives? Number one, we are the best. Go USA. We are the best with crisis care. Okay, that means you get in a car accident, you have a heart attack, whatever the case is, when you are on your deathbed, we are in the best place for somebody to save your lives. We have the most doctors, we have the most medicine, we have the best technology in order to save your lives. So good on us. We're really in the right place for that. But the big question that we're going to ask today is, where do we rank in overall healthcare? Give me some guesses. So not just crisis care, but overall, everything, life expectancy, everything like that. Are we number one still? Number two? Number five? Where do you think we are? All right, we are number 37. Yes, 37, and that was in a study done in 2007. So things have changed since then. So that means that 36 other countries are better at healthcare than us. They're better with life expectancy than us. It's countries with less doctors. They have less medicine. They have lower quality technology than we do. But they're healthier than us. So how does that work out? It sounds kind of weird, right? Doesn't really make a whole lot of sense. If we have the best healthcare, we're number one in crisis care, why are we so much lower in overall healthcare and keeping people healthy for long term? Another really crazy stat here is that we're 24th in life expectancy. And I don't know the exact numbers, but I know we are in the 30s, last I checked, with infant mortality. So we have some places that we can really grow. So if we're number 24 in life expectancy, but yet when somebody's going through a crisis, we can save their lives better than any other country, we might be doing some other things wrong. So what is it that we're doing that isn't working out so hot? So let's talk about diet. I know this is not really the topic that you thought you were going to get into today, but in order to know about life and vitality, we have to talk about the opposite end of the spectrum too. So what are the 3 leading causes of death in the United States? Okay, can anybody name one? I'm going to give you a couple seconds to think. I can almost guarantee that you at least know 1 or 2 of them. Okay. So what are they? Well, number 3 cause of death, drum roll please. With 500,000 people dying every year, it's cancer. So in cancer, we get this mindset. My mom had it. My dad had it. My grandparents died from it. I know this person who has had cancer. So we get in this mindset that they had it. I'm related to them. I grew up with them. I'm going to end up with cancer. And that's what's going to get me. Well, fact is, if you looked at over the last 40 years, there's been a 10-fold increase in cancer. So 1 out of 3 men and 1 of 2 women die from cancer. And 40 years ago, it was 1 out of 30 people that were dying from cancer. So what changed everything? What caused this dramatic rise in death from cancer? Okay. So do you think in the last 40 years our genes changed? They don't really change that fast. Okay. Maybe some other things have changed. What about our diets, our lifestyle? How we're working out, the stress levels that we have at work, the what we're doing at work. Maybe some of those things have changed. So research shows that between 95 to 98% of cancer is lifestyle related, and at most 5% of cancer is caused by the genes that we have. Genes are really just they're like a loaded gun, but something still has to pull the trigger. So we might be predisposed to stuff, but we still have to turn the genes on. And so we have $60 billion a year spent every single year on average for treatment and research to cure cancer. And how's that working for us? We haven't really found a cure for cancer yet, have we? We might be better at saving people's lives at the end, but we are still not preventing cancer deaths. And that, just in the last couple of years, we've been spending even more money on cancer research, $200 billion just on treating cancer treatment and research a couple of years ago. So we're not doing so great there. So what about number 2 cause? And I just actually showed it, but number 2 cause of death is heart attack. Yes, heart disease. I think we've all known somebody who's had a heart attack or some peripheral vascular disease. So how are we at treating heart attacks? Well, we have pretty good success rate with being able to treat it if we can get early prevention. But 800,000 people a year die from heart attacks alone in the United States. Okay, so what is heart attack's nickname? Does anybody know what the nickname is? It's actually called the silent killer. Why is it called the silent killer? It's because the first symptom of a heart attack is death in 60% of the cases. So the very first symptom that people will experience is death in most cases. It's not the tingling in the arm or the pounding in the chest or feels like an elephant sitting on your chest. It's none of those symptoms. So we have to be good at finding cancer before it actually, or finding heart attack before it actually occurs. So by the time a person feels a symptom, it's often too late and they're dying. So a person with heart disease may say, you know what? It's Wednesday. I'm feeling pretty good. But in 12 hours, they could be dead if they don't have any warning signs. And would we call that person healthy or would we call that person sick? Just because they don't have any symptoms does not mean that they're necessarily healthy, right? Okay. We associate that all the time, but it's just not the case. So heart failure is one of the fastest growing diseases in the country today. Why could that possibly be? Could that also be lifestyle related? Could that be related to stuff that we are doing or not doing in our lives now that we were or were not doing 40, 50 years ago? Okay. So that brings us to number 1. What is the number 1 cause of death in the country today? Does anybody have an idea? This one actually is probably going to throw you because it definitely threw me off. So don't worry, it'll blow your mind. Let's get right to it. Number 1 leading cause of death is medical care. Yes, it did throw me off when I read this. And, we'll walk through this. I have some research to show you. But research says, according to the Journal of American Medical Association, these are the ones that we know of. There's 212,000 people a year that die from adverse drug reactions. Okay, and only about 5 to 20% of those are actually reported. So that number could be significantly higher. Okay, and that's from licensed drugs that have been put through the tests that are required, and those are years of tests from phase 1, phase 2, phase 3 before they even reach the market. So according to the same journal, 145,000 people die per year from unnecessary surgery. That's surgery that you don't need. It's not life-saving surgery. It's more often for pain or cosmetic, whatever the case is. No surgery is really a safe surgery. If 145,000 people die from surgery that they don't even need, that's a big problem, right? So, and more often than not, people go into surgery like, oh, it's just a surgery, it's going to hurt for a while, but, I'll be okay. This is still a kind of a problem. So 28% of all hospital visits are actually from those adverse drug reactions. That's a major problem. Well, and on top of that, 100,000 people die from infections that they contract in the hospital that they didn't even go there for. So 28 out of every 100 people go to a hospital because of an adverse drug reaction, a drug side effect that they're taking, and they might even get a disease there that they end up succumbing to. The funny thing is, I just saw an ad for a new drug for opioid-induced constipation, if you've heard of that. So yes, opioids are known to cause constipation. So now we are taking drugs for the side effects of another drug that we're currently taking. And an average 60-year-old is actually on 6 different medications. And really, those drugs were never tested with each other in conjunction. They may be done post-market, so after they go on the market, but they're never done in clinical studies before they're released to the public. So we don't even necessarily know a lot of times when they first are interacting if they're going to cause a problem or not. So this year, 1.2 million people will be killed from normal medical practice. That's a scary thought. I mean, that's as many deaths as we had on 9/11, and that was kind of a big deal. That was a day that really rocked the United States, that changed how we live our lives, how we go to the airport and travel. So medicine kills as many people as one day in 9/11. And don't get me wrong, I'm not at all trying to bash medicine. Medicine has a time and a place, okay? I always talk about having a guardrail on a drive up the mountainside, which is what I believe chiropractic would be, is trying to prevent you from falling down the mountain. But if you fall down, that's the time that you're going into your medical office, okay? That's when, you break an arm, you get in a car accident, you are having a heart attack or a stroke. You go to your medical doctor because they're the best at saving your lives. But are the drugs that we're taking on a daily basis, are they saving our lives, or are they actually making us healthier? Are they making us sicker? And that's the question that we're trying to answer. So most people use medicine not for crisis care, which they're the best at, but for reaction to mask the symptoms because of years of poor lifestyle choice. So, I have family in the medical field. I have great respect for what they do. I chose this career path because I know that making better lifestyle choices is going to help empower people to live healthier lifestyle, so they don't ever need to go that route, that they don't need medications, okay? That we don't need to get to that point where we fall off that cliff and need help back up. If we can find a way to get people to not have to go to need unnecessary surgeries or medications, then we're doing our jobs. Okay, so we're here to try to prevent these deaths, okay? So if we can help prevent the need for medications, we're doing great. So most of these are preventable. That's the commonality between all 3 of them, is they're preventable. So how many people are open to spending the next 30 minutes to staying healthy? Okay. The coolest thing about our bodies is they're made to heal. You cut your arm, guess what? You don't even need a Band-Aid. You don't even need to think about it. Your body's going to heal that, okay? It just does it on its own. We started from 2 cells at birth. We had a sperm and an egg. They come together, and those 2 cells over 9 months create a human baby. They make a leg, a liver, all that pretty cool stuff, right? And it's self-healing. That's an amazing miracle. If you've ever studied embryology, you know that there are so many things that could go wrong, but it almost never does. How does that happen? Our bodies are just this amazing machine. Okay, better than any machine that we've ever created. So the power that made the body heals the body. Okay, God created us that way. This is the tenet of chiropractic. Our body's made to heal, and if you're not healing well, there's a reason for it. And not because you woke up with some deficiency for medication this morning. You're not in pain because you don't have enough Tylenol in your system. Okay, Tylenol is helping to mask those symptoms, but it's not going to heal the actual problem. Okay, so life is energy. Okay. More reasonable is you're deficient in proper healing and proper energy flowing through your body, because what you are is nothing more than energy. Okay, we may not feel that way right now. During the middle of the week, we might be lacking on energy. Sometimes we even wake up and like, man, I just don't have energy to do this today. That energy is what's keeping you alive and well. Okay, we are a bundle of energy. The energy is flowing literally in your body as electricity. Your heart can stop. You can stop breathing, but you're still alive. You aren't officially dead until there's no electricity going on up here, okay? So the electricity is flowing through something called the nervous system. That's your brain, that's your nerves that are communicating for every cell in the body. It's an information superhighway. They coordinate all the functions of your body. It's the master control system. Whether you are consciously or subconsciously using your system, most of it is subconscious. We are using that information to keep our body functioning normally. And so how you adapt to your environment is exactly how the nervous system works. We're in Wisconsin. You can go from a 60-degree day down to 30 degrees and snowing 2 days later. How does your body adapt? Yeah, you might be shivering, but that's your body's adaptation to the cold. That's what it's supposed to do, okay? So we can deal with different seasons in Wisconsin. 90, 100-degree days, all the way down to negative temperatures. And we are able to work with that and adapt, okay? Even if it's reaching for the coat, our body knows that we need to reach for that coat. So the nervous system controls and coordinates all the systems of the body and relates the individual to their environment. That's according to Gray's Anatomy, which is that is the gold standard for anatomy books. So starting up in your brain, traveling all the way down your spinal cord like a raging river, it's an amazing 300 miles per hour, carrying electricity and information to every cell, every tissue, every organ of your body. Every one of those cells is dependent upon the nerve signal to stay alive. If you separate any cell in your body from its nerve signal, it dies. Some cells actually have no blood supply and still function just fine, but there is a constant nerve supply. We have to maintain that communication or the body doesn't heal. So when we talk about nerves, okay, we have to talk about the spine. Okay, they're not the same thing, but they're related. Okay, they're connected, and they do play a role together. Out of 9 systems in our body, our central nervous system, which is the nervous system with the brain and the spinal cord, it's the only one completely encased in bone. Our skull and our spine, as you can see right here on screen. Okay, so protection is exactly why it's encased. It's very fragile, okay? If you bruise your skin, a week or two goes by and it's like it never happened. If you're bruising your nerves, it may not take a day or a week. It may take months, maybe years. Sometimes it never even heals. I mean, we all have heard those stories of people who have had concussions, okay? Some people, they actually do worse over the course of time. Some people will be able to heal in a couple of days, weeks, months, okay? But it's more wide-ranging than if you bruise a muscle or your skin. Okay, so your spine should be straight, just like we see on screen here in this view. Okay, on the side view, that's a different story, and we'll go over that later. Okay, it's like having a good straight water hose washing a car. Okay, watering plants, whatever. If you have a hose and it's functioning and you have water flowing out of it, that is exactly what it's supposed to do. This energy is supposed to be remaining constant. But say you're watering your car, washing your car, watering your plants, and all of a sudden the water stops. You look back, there's a kink in the hose, okay? What did it do to slow down the flow of water? Okay? That kink in the hose stops the flow of water. And that same thing can happen in our spine. It slows down the flow of energy to your brain and the rest of the body. You don't have the good, proper communication. So much of that is so much so that if your spine has a curve, 10 degrees, it's called scoliosis. Once we get to 20 degrees, research tells us that the person's lifespan on average is 14 years shorter than the normal person. And it's not because they have pain, but because they're compromising their nerve function, which ultimately leads to compromising their organ function. And you can see all the organs on the screen here. Those are the different organs that are related directly to those spinal areas, okay? So that's why it's important to have our spine straight, so the brain can send messages without interference to the rest of the body. Okay. So when we look at the nervous system and the spine, the main thing affecting our function of the nervous system in a negative way is something we call a subluxation. Okay. Who remembers what a subluxation is? Okay. I like to explain it this way. Okay. If your spine has shifted out of alignment as a result of trauma or stress, we had trauma or stress of some type, it's a lot of times it's micro traumas, that can lead to a subluxation, which is a lack of movement of the joint. So if you're driving down the road and you have a tire fall off, that's like a dislocation. Big problems, major injury. Your body's not gonna feel too good after that, okay? That's a dislocation. That's a major form of subluxation. So the joints aren't met, they're actually separated. A subluxation is more like you're driving down the road, tire is wobbly, You might not notice it right away unless you're really in tune with your body, but over the course of time, it can decrease gas mileage, which is so important. It could also cause you to veer out of the lane if you let go of the wheel, or if you loosen your grip. But it also can do damage over the course of time. So not a day goes by that we don't experience some level of stress, because of the stress, your spine shifts out of alignment and compromises the nerve function, and also interferes with your body's ability to heal. So run your hand down the base of your neck, okay, and you're going to feel a spot right here, the spot that's really sticking out. That's T1, okay. That's your thoracic 1, okay. Those nerves that come from that, they go to your heart and your lungs. Kind of important stuff, right? Without it, you're not too happy, and you're probably not going to be staying alive for too long. So if you have a subluxation at that level, first it will compromise those nerves, and it also puts a dam in the river. So that slows down the flow of energy. And if we have subluxation in our neck, that slows down the flow to the rest of our body. So 90% of people with low back pain, they have neck problems that contribute to that. So trying to send a message to the low back and how to grow function and heal, and messages are blocked because of the issues with the neck, okay? So we're gonna have some problems with the low back because energy is not flowing through here properly, okay? So second thing, when you have subluxation, it weakens and affects overall posture. It's gonna change your ergonomics, it's gonna change your posture, it's gonna change how you're able to hold your head and your body, okay? So when we have poor posture, our spine breaks down sooner and causes nervous system not to function properly, and literally your body can't heal like it should, okay? So subluxation is a trauma or stress. Stress of the nerve will shut down energy flow. Okay, they weaken or distort your overall posture, which leads to accelerated aging in your body. Okay, so the effects of subluxation. So the weight of one quarter on a nerve shuts the life energy down 60%. Okay, the weight of one dime shuts the life energy down 40%, 40% less function. It only takes a tiny amount of pressure on a nerve to compromise its function. So that's why we look at posture. So you can see the nice straight spine on the small one, and the big picture actually shows the subluxations and the curves side to side that would be known as a scoliosis. That can put a lot of pressure on the back. So how do these subluxations, postural distortions develop? Okay, comes down to one thing: stress. Okay, but there's different kinds of stress. Okay, so first one is emotional stress. So any job, significant other, kids, financial stress, sickness in the family. There's not a day that we don't experience this kind of stress. So when we're stressed, are we tight and relaxed or a little tense? Your body has the same response to stress as a bear chewing your leg or arguing with your spouse. So the same response, the fight or flight. The brain receives a problem that we got to survive, and so we send messages to the adrenal glands, and they secrete cortisol and adrenaline to help your body get into fight or flight response. Okay. As those hormones are released, they cause your muscles to tighten up, and as those muscles tighten, they start to pull on your spine. Suddenly, we create a subluxation just because of things going on between your ears. Okay, and a lot of people don't equate these stressors with physical pain, but they are a huge cause of physical pain, and a lot of times they're really not addressed. Next one, chemical stressors. So, chemical stressors: cups of coffee, okay. Couple pots of coffee, not really okay. Okay, soda, alcohol, tobacco, medication. Not a day goes by without chemical stress. Even sitting at a stoplight and getting exhaust from the car in front of you. Anything you rub on your skin. So any of the lotions, the makeups, anything that you're putting on your body, if you wouldn't eat it, don't put it on your body because it can stress out your body. Okay, your organs have to process all that garbage. So it causes a visceral somatic or an internal external reflex, which sent as a result of chemical stress to your body. Guess what happens? Same thing, muscles start to tighten, pull on the spine, create a subluxation just because we're exposed to different chemicals. Physical stressors, that's the one that most people equate with physical pain. But again, any of the three can be. And this is actually the easiest one to correct out of all three of them. Car accidents, sporting injuries, sitting, Sitting into the spine is like sugar to your teeth, and we're spending more and more time sitting for work, more and more time sitting in front of computers, watching TV, hunched over our phone. We have a new thing called tech neck because we're spending so much time in front of technology that's altering our physical posture. So your spine has to move to stay healthy. And when we're sitting, we aren't moving, and it breaks down from constant chronic stress. Okay, so two effects of subluxation. So more of the story is, lots of things can cause subluxation, blocking energy from your brain to your body, and they make distortions in your overall posture. So it blocks energy, and you can see in this picture, that's pressure being applied that's not allowing that flow of energy. Okay, so you may experience some of these symptoms from nerve stress or weakness. What do you think is the most common sign of nerve stress or weakness? I'm going to give you a couple seconds to read through these. Okay, your eyes may be drawn right in here because fatigue. Who feels they should have more energy? I think all of your hands would be going up. About 95% of people, regardless of age or what they do, wonders why they're so tired all the time. I mean, a lot of us wake up feeling tired and want to go to bed or take naps, or we're drinking Red Bulls, or we're drinking extra coffee. There's so many different energy drinks out there and promises of energy from different supplements, okay? This is something that is a chronic issue with people throughout the United States, and taking energy drinks or supplements that promise better energy will only last for so long if we don't address the root cause of the problem. Okay, another one, birth trauma. Okay, how many of you were born? That's right, all of us were born. Okay, there was probably no more immaculate conceptions, no more immaculate births. Unfortunately, this is the most often when the first subluxation happens. So moms are supposed to push the babies out. Now, doctor grabs the baby's head and pulls the babies out. Anyone want to take a new baby 7 to 9 pounds and pick it up by its head? No, we'd be stared at. It'd be barbaric. The research tells us that a normal vaginal birth is 70 to 90 pounds of force applied to the baby's spine. So picking a baby up by its head, then you think about forceps, vacuum extraction, which is about 5% of births. That's 120 pounds of force. You know what happens at 140 pounds of force? Yeah, the baby's head does not stay on. It comes right off. Yikes, that's terrible. It's a horrible thought to think of. And not to gross you out, but I want to show you that being born the way we do it now, normally, can be the first assault to your spine. And it can be where the first subluxation occurs. Some of the things that we have in our spines actually happen very early in life and has gotten worse over time. And it's important for babies to get checked too. So even the position that moms are put in for birth is actually narrowing the canal, which is a topic for another day, but it's bad for moms' backs because they're putting a ton of pressure on their discs and on their low back, especially with pushing. And then it's also kind of rough on babies. So again, another topic for another day. But kids, when they come into our office, they're not coming in complaining because their neck or their back hurts, but usually it's things like ear infections, constipation is really big, asthma, allergies, chronic colds, chronic flus, all indications that their nervous system is not functioning properly because your nervous system controls your immune system. So research shows 80% increase in the immune system for 48 to 72 hours after an adjustment. That's why kids feel better after being adjusted, because we're removing the nerve interference that allows them to be able to heal themselves properly. It's a 200% or an 80% increase in immune system function, but also an increase in T lymphocyte function, which is white blood cells. So as the twig is bent, so grows the tree. If the spine is bent, we can reverse things like scoliosis at a younger age because kids are more pliable. They can heal faster. So it's important to get your kids checked, your kids, your nieces, nephews, grandkids. Whatever the case, they should have their spines checked, no different than having your teeth checked for cavities. You wouldn't miss an appointment there. But it's important to have their spines checked for subluxations as well. And as the son of a dentist, I know how important our teeth are, but our spines are more important because we house our spinal, our nervous system there. And if the nervous system is lacking, everything else suffers. Our teeth, very important, but you can replace a tooth that goes bad. You can't replace your spine. So here's here's what we see when we look at the neck. This is a normal neck, normal curve, nice 45-degree angle. So people come in, they say, but my lower back's my main problem. But remember, 90% of people with low back pain have a bad neck that's contributing to this. So we call this the arch of life. The spinal cord is relaxed and energy is pouring from your brain to your body. This curve actually allows the spine to have a 16 times greater strength when it's in proper alignment. So a scientist named Alf Brigg studied anything and everything related to the spinal cord. And some of the studies in relation to something called MS, which is also known as multiple sclerosis. Okay. So most people have heard of it, but they don't know exactly what it is. Basically, MS is degeneration of the nervous system. Your nervous system has insulation around them called myelin. And myelin is a fat. It's no different than the plastic around a wire in your house or your car, and an insulator to electricity can flow through the wire. So it speeds up the flow. When MS patients, with MS patients, the myelin that actually comes off of the nerves, and all of a sudden we basically have a short circuit. So these people end up in a walker, a wheelchair, and eventually die early. So Dr. Brigg looked at all these people with MS, and they did a study. They did a surgery that let the people in regardless of age, race, gender. The only common thing was they lacked a curve in their neck. So what they did was they actually did surgery. So they sliced them open, peeled back the muscles, pounded a curve back into their spine, used wire mesh to artificially induce the curve back into the neck. They sewed them back up, and guess what happened to their MS symptoms? That's right, they went away. But nothing was really done to help strengthen and rehab the muscles that are responsible for maintaining that curve. So slowly over time, what do you think happened? The curve went away. Guess what happened to the MS symptoms? They came back. That's what happens if we don't do things to maintain all the benefits that we're correcting. So that's where we do things unique. That's where we do things differently. We're not going to show you how to restore that curve. We're going to show you how to do it naturally, is what I meant to say. Okay, so no surgeries required. We also want to show you how to keep it that way. Okay, because what good is it if we fix the problem, but then we allow it to come right back? Okay, so that's pretty cool, right? So this slide actually illustrates why all this occurred. So the first picture, okay, that is a normal curve right up here on the left, and one that says normal. Okay, so this is the X-ray, and that's the MRI right next to it. So you can see the curves, nice good curve. You can see that nice bright white spinal cord right in there. It's good energy flow all the way down. Okay. So we took little slices of the neck, and that's the middle of the spinal cord. And you see how big that spinal cord is, okay? How there's no indentations there. It's nice and nice flowing. So just from going to the first phase of spinal degeneration, where we have a nice straight spine, or not nice, but a straight spine, okay? You can see in the MRI that it doesn't look quite as big of a spinal cord, okay? So you can see it down here, that nice big wide spinal cord, and then loss of normal cervical curve. That's just from phase 1. That is a lot smaller than that first picture, right? Probably half the cord with the normal curve in the neck, right? So which cord would carry more energy, the little one or the big one? Of course, it's the big one. The big one's going to carry more energy, more electricity. The body is healing, growing, and developing at a better rate. The smaller one, you have half the juice, body can't function, and ultimately, yes, you will be tired. You'll have fatigue. And that's why a lot of people have other issues beyond pain before they even have pain that brings them into our office. So a lot of times the fatigue is one of the earlier signs, but we just don't associate it with spinal cord irritation. This is an X-ray of a woman involved in a car accident. Medical doctor says she's fine because she didn't break anything. Okay, no blood, no broken bones. You're good to go. But she's having headaches, neck pain after the accident. Goes to the chiropractor and to see what she can do to get some help. Okay, so what do you see? Okay, see that decrease in the spinal curve, okay? That is actually a forward head carriage, okay? So what happens 7 years later? Okay, this is an x-ray 7 years later after the initial injury. What's happening? Okay, she's still developing progressive degeneration. So you see this area right here, that space is not only decreased even more, but you have a larger osteophyte formation or bone growth to try to stabilize that joint. So those are bone spurs, okay? They're degenerated discs. The discs are breaking down, posture is getting worse. So obviously the chiropractor alone is not correcting her problem. So now we go to 14 years later. It's further advancing posture. The postural deficiencies, okay? Degenerations are worse. So it's spreading to multiple levels. So it's not just that one joint that we saw earlier, but now the joint above it is starting to degenerate. The forward head carriage is even worse, okay? So we have multiple levels of compression of discs, and ultimately the nerves are degenerating. And now we have hard bone on soft nerve growing into the spinal cord, and the nerve is extremely damaged. So posture is worse, causing spinal cord to get stretched and causing energy to go way down. So it causes stress on what two big organs? If you remember when we were talking earlier, we were talking about this lower part of the neck interfering with the heart and the lungs. The nerves go right there. So what's happening to overall health? Is it getting better or is it getting worse? Well, it's getting worse. So the big question is, can she be helped or is this permanent damage? Well, cool news is that it can be helped. Your body has the ability to heal. We just have to give you a nudge in the right direction. So, health goals. So, gut check time. What can you do or what can you not do or not enjoy now that maybe you could still do if you work on this, okay? Okay, can you still do your work and your hobbies, but do you still really enjoy them as much as you did before or should? Okay? So what are you unable to do or enjoy because of your current health challenges? Okay? Okay? We all know if you're not at our physical best, we aren't as happy. We're not as kind. Sometimes we're moody, okay? And we're not as easy to get along with or easy to be around. Maybe even a little short with people that are close to us. Okay? So fast forward 20 to 50 years. What activities would you like to be able to do? Okay? The problems we have aren't taken care of now. As we get older, what's going to happen? Are they going to get better or are they going to get worse? There is no staying the same. If we're green, we're growing. If we're ripe, we're rotting. Okay? And who do you want to be doing these activities with? And do you want them to stay healthy? Because ultimately, if we have our health, but the people closest to us aren't, we aren't going to be able to enjoy things to the highest level. Okay? So if your health problems are not corrected, do you think they're going to get worse? And the simple answer is yes. So write down your goals. Okay? This is something I really encourage people to do, not even just with their health, but overall. So write down your goals, sign it, discuss it with the people closest to you, and hold each other accountable to what you want to do and how you want to grow. Because if we don't have written goals, we're probably not going to be able to achieve them. Okay? We don't know what we need to do until we write them down. So how do we make this happen? Okay? So spinal and postural regenerative program. Okay? So rejuvenation is the opposite of degeneration. So we're now no longer breaking down the body. So rejuvenation is younger, healthier, full life, and your body's healing yourself. So this is what the SRT is. This is a state-of-the-art system. It's been designed to bring about these life-changing results. It's a really unique therapy that we're trained extensively on here. And really, there's about 2,500 chiropractors in Wisconsin, and less than 1% do what we are talking about here tonight. So you're really in a unique place. First thing we need to talk about is your posture, okay? So postural control, okay? It's mainly reflexive and voluntary. Okay, so if your posture doesn't change, your adjustments aren't going to last very long. The fact of the matter is, your posture just doesn't change by just thinking about it. If I just asked you to sit up tall, okay, you might sit up tall for a few minutes, but you quit talking about it, you quit thinking about it, and your posture goes right back because you stop thinking about it. You stop making it top of your mind, and your body goes back to what it knows. Okay, but your posture is actually an involuntary reflex, no different than learning to hit a ball, shoot a free throw, ride a bike, play an instrument. If you do it repetitively enough, you get to the point where you don't have to think about it anymore. You actually created a neurological reflex to do that. Basketball players are famous for shooting thousands of free throws because it then becomes involuntary and they aren't getting as distracted. Your posture is the same way. Your adjustments are one key part. We have to get your spine moving and your nerves functioning better, but by itself, it's not going to make you have better posture because we have to work on getting the weak postural muscles stronger. Okay? The ones that actually keep you upright are different than the muscles that we exercise at the gym more often, because the ones that we exercise at the gym, like our biceps, they're known as fast twitch muscles. Okay? They're exercised with more repetitive, quicker movements, and your postural muscles are slow twitch muscles. You need longer, sustainable holds, and we'll explain that in just a moment. So the cool thing about all this is we're going to teach you how to fix yourself. Really, 2/3 of your long-term change are things that you do at home. Okay? So we're empowering you to do a lot of this work. We're going to show you how to do it. And ultimately, that is how you keep it that way. So I'm going to teach you how to floss your spine. That's kind of cool, right? How do we maintain these effects of the adjustment? So first thing we have to do is we have to find out what you're able to do at home. What this is a stress test, and it tells us how strong your spine is and your nervous system is. I'll go through and demonstrate the SRT warm-up exercises, followed by an adjustment that we can do with a weighted x-ray. Okay? So the weighted stress x-ray, this is a weight x-ray. So the first one here is without the weight, the second one is with the weight. Okay? So we take a harness, we put it on your head, put a little weight in the front, and then on your pelvis as well, and your body is programmed to move away from the weight. So you put something heavy in one hand, what do? You lean away to compensate. It's a reflex. Same thing if we put a backpack on our shoulder. You don't have to think about it. You just do it. You put a little weight on your forehead, what do? You're going to pull your head back. It's the same thing for your pelvis. Okay? So you push your head back and pelvis to get them lined up over each other and relax the spinal cord and take tension off your discs. What we should see with a person with no curve heads, when they put the heads forward, when we put weight on it, we are looking to for a change in posture. So this is with no weight. Our head is forward. When we put the weight on, our head comes back. You can actually see the weight up here. Okay? And if we do see improvement, we know that you're strong enough and that head comes back. You can do this at home. That's why we do the stress test, is to see if you're able to handle this or not. So next we have to start make the process of, okay, this is going to be weird, but we're going to make Jell-O. I know we didn't see that one coming, but what is the first thing you need to add to Jell-O? Water. Okay, we've all heard that your body is 70% water, but your nervous system is 90% water. These discs in your spine are 88% water. Interesting about these discs, they are unique and called a white tissue, okay? Which means that there is no blood supply, okay? I'm going to go back here. So discs have no blood supply. So how do you get water and nutrition brought to them and waste products get pushed away? You have to move them. So motion pumps water into the discs, nutrients in the disc, and actually pumps waste away. So that's how. It's the only way that you can get the nutrients in. But here's what happens when you have a subluxation. Spine shifts out of alignment. That segment of your spine is not moving anymore because it's locked. The disc is now losing nutrition and hydration, and you add in sitting, putting further weight on that disc, squeezing it slowly over time, that disc is going to start to shrink. Year after year, that this disc shrinks. So over time, your body says, this is not good. It says we need to stabilize this area. So what's the body's response? You're going to lay down more bone. This is when we start seeing the jagged points, these bone spurs start to creep all with the goal of trying to stabilize. So what do we have to do to get your spine adjusted, get it moving again, and then start pumping these discs up? Got to get some motion in it. So we actually do that first before we even get the adjustment. So how much water do we drink a day? Well, you take your body weight, divide the number in half. That's how many ounces of water to drink in a day. So half your body weight in water every day. If you drink a lot of coffee, alcohol, energy drinks, they're going to dehydrate you more. You actually have to add more water for every cup of coffee, soda, and energy drink that you drink. And about the equivalent in ounces of water. So 20 ounces of coffee, 20 more ounces of water. Okay. Now nutrients. So we take a shot of Himalayan sea salt water before exercise because the purpose is that these have trace minerals and nutrients. 84 trace minerals and nutrients will help hold onto the water, and those minerals and nutrients help relax muscle spasms, relaxing tight muscles with the goal of, before doing exercises, it'll help hydrate and help relax your muscles. Okay. We also have glucosamine and MSM are supplements to help rebuild damaged joints. So if it's your knee or your spine or any joint, it's a good supplement to take at home because building blocks of your joints. Okay. So next, we got to start warming up the body. Okay. So the first one is the 6-way stretch. So think about athletes. They warm up and loosen up ahead of time. To prevent injuries, play better, and feel better the next day, you have to warm up. So the same thing applies to your body. If we can warm up your muscles and ligaments and discs, you will be able you'll be able to be adjusted easier, and adjustments will last longer. So the 6-way stretch is going to stretch the neck, chronically tight postural muscles to help go through, so the adjustment is easier, help hold the adjustments longer. We spend most of our day sitting. Our bodies are cold. They're not going to really move as well as we want them to. Okay, the repetitive traction. Okay, look at that handsome guy doing this movement. So these are the same at home as they are in the office. The only difference is the one at home goes through the door. So this setup is what we have in the office, but at home, this rope goes over the door and we give you a door hang. Okay, so the benefits of repetitive cervical traction. Okay, when you step up, it should be at chin height. Okay, so that's where those handlebars are. Palms facing you, elbows tight, so the body toes are on the wall. Just start like you're going to sit down. As you go down, you start to push that curve into your neck, increasing blood flow and muscles, pushing the curve into the neck. And if you listen closely, you can hear that water getting pumped into the disc. Okay, so it's loosening and pumping your discs and adjust. It allows you to adjust easier and hold the adjustment better, so we can override those natural reflexes. It also stimulates the upper part of your neck to release endorphins, which are natural painkillers because of the movement in your upper neck. Okay, if this ever hurts, it's because you're putting too much weight on your neck and not enough on your hands. So 90% of the weight is on the hands. All right, next one. This is the wobble chair that I'm sitting on. Okay, so who wants stronger abs? Everybody wants stronger abs. So we contract our abs to stabilize and strengthen our core as we start going side to side, getting warmed up. Then front to back, getting the pelvis and lower back warmed up. Basically working the mid-chest all the way down. Next, we squeeze the abs and move our pelvis to the 4 corners of the box. And then we repeat a figure 8, hitting all corners of the box, driving water and nutrients into the disc. So way more movement than walking, as well as warming up muscles. So we can decrease injury because we're strengthening the core muscles. As we stabilize the muscles in the core to prevent this from happening, the leading cause of disability in the United States today is chronic low back pain, because when a person gets injured, the nerve signal actually decreases the muscles now get weaker, and this keeps happening over and over and over again because it's an unstable area. So we have to strengthen and stabilize the area and keep it that way. We want to lubricate the joints. So we're circulating CSF, which is cerebrospinal fluid, to and from your brain. So don't be surprised if you get smarter doing this. It brings the brain and spinal cord more nutrients, so you actually get smarter doing this. The breathing in through your nose and out through your mouth helps along with the wobble chair to circulate the cerebrospinal fluid flow. The next one, okay, this is a foam roller, also known as a thoracic roll. Okay, so you can see we're now moving onto the mid back. Okay, so we warmed up the neck, we warmed up the lower back. Now it's time for the mid back. So we start at the bottom of the rib cage, like this picture here. Okay, and we come up, do a crunch, increasing blood flow to the mid back. Muscles are warming up and we're lubricating the joints. So you may feel some movement in your spine. That's okay. It's a little mini chiropractic adjustment at home. Okay, it's an accidental cavitation, as we call it. Okay, the cavitation is just that pop or click. It's a difficult area to adjust on some people because we spend so much time sitting hunched over. So this is a great tool for use here and at home as well. These are the basic warm-up exercises. You can get the warm-ups done in 8 to 10 minutes. We tend to do about 2 to 3 minutes per exercise. So after you get these loose, it's time to be adjusted. And you'll adjust a lot easier, and the adjustment will hold a lot better when we do this So some people, they need to take it a step farther. That's where we add the spinal rejuvenation table. So this is a spinal decompression, either from the neck or from the low back. So we showed you a picture of each. The top one is for the neck, the bottom one is for the low back. Okay, so this will actually create a vacuum inside the disc to pull in water and nutrients back into that area. So even if it's bulging or herniated, it draws nutrients back into the disc to become hydrated again, and it pulls the kinks out of the spine. So it can strengthen the postural muscles. You basically lay around and get stronger when you're on the decompression table. It pumps the disc to get better movement. So we pull at it on the neck or on the low back at a certain weight that's dictated by your presentation when you first come in, and we open it up, and then we take some pressure off to release some of the tension, which pumps the disc back and forth for 15 minutes while you're on the table. All right, after you get adjusted, then that's when we put on the weights. Okay, so every time you wear the weights, we're going to work on that posture. So this is the head weight. Okay, so we're actually going to put that on the head with a weight in the front, whether it was 1, 2, 3 pounds. Okay, we will almost always start with 1 pound. So every time you wear the weights, we're working on that posture, pushing the head back, getting better posture, taking stress and tension off the heart and lungs because of improvement in posture. Either here at home, you'll wear this for 15, 20 minutes to hold and stabilize your adjustment, make faster, more permanent change. It's the easiest thing you can do, but it's also the most important. So it's the easiest thing to do, most important. You can walk on a treadmill watching TV. You can be eating dinner. Every time you do this, your body is saying, hey, this is normal with the head back, neutral over the shoulders, not hunched over. Your body likes this, and it's going to start to adapt. Which brings us next to the fulcrums. Last thing you do at home is the home fulcrums. You guys remember what we were making tonight? Jello. So when we made Jello, we added water to heat it up, okay? Now after that, you have to put it in a mold. We have to mold your spine. I'm going to mold before your eyes. Actually, you'll see the picture right up there. As that person is laying on the fulcrums for the lower back and the neck, the muscle ligaments and discs are starting to cool down and take the shape of the fulcrums at a nice 45-degree angle. This opens the discs up again, relaxing the spinal cord, increasing circulation into the spinal cord. Some of your blood capillaries are so tiny that the red blood cells go through single file. When we relax it, we will help increase the flow of blood along with the nutrients. That's pretty cool stuff. So on the fulcrums, we do isometric exercises. So we're holding and strengthening postural muscles as you get stronger. We add on new exercises as you progress through the treatment. So usually it's going to be a few weeks in between this. Okay, so this will help progress and get our curves back into our spine as fast as we can, but also hold it. So we don't want to rush through this, but we want to make sure that we maintain. Okay, so if you do that, look at what happens to the curve. So this is the first follow-up x-ray. What a huge change. Really straight spine. You can see some of the discs in the lower part of the neck are even degenerating. And then a follow-up, that curve looks beautiful, 38 degrees from -2. That's incredible, okay? So prior to the spinal rejuvenation therapy, never really saw that, okay? But we've been combining chiropractic adjustments and spinal rejuvenation therapy. We get changes like we never saw before. Here's another picture. Okay, 14 degrees to 39 degrees. What a huge change. This is going to see really amazing results beyond just pain. So, family that gets healthy stays healthy together. So this is Pam. Pam has radiating pain and numbness into the legs. Only went away when she was standing on one leg. She had a bulging disc, and the MD said that they wanted to do surgery, and research shows spinal fusion, which is the most common type, which is long-term, 3 to 5 years out, is a 2% success rate. So 3 to 5 years out, you have a 95% chance that you will be no better or possibly worse. Close to 70% of people with one spinal surgery end up having multiple spinal surgeries. You can see a stair-stepping effect back here, okay? So nice straight line and then a step back and as it goes back up, okay? That's damage to the ligaments. Okay, so it's ligamentous instability. It's been damaged over time. In about a 4-month time frame, she did all the things, got adjusted, spinal rehab, exercises, everything we described tonight. Huge increased disc space. Look at this space on the right side. No stair-stepping, in fact. Okay, the ligament stability has been restored. So the moral of the story, your body is made to heal. There's no drug, no surgery that can do that, but your body can by giving it what it needs. Proper spine and nervous function, proper movement, proper muscle strength. So 3 phases of care. Okay. Number 1, the initial intensive care. Okay. So initial intensive care. Most of you are in crisis. That's what brought you into the office in the first place. Okay. There's been a disruption in the nervous system and your body isn't healing or functioning properly. So we want to get you back to health and vitality as quickly as possible. In order to do that, we must reduce inflammation. If you have pain, you have inflammation, they go hand in hand. So you can't have pain without inflammation. You can maybe have some inflammation without pain, but we'll get to that later. Okay. So as you can see, that's where we do a few times a week, 3 to 5 times a week for the first 2 to 3 weeks. That's where we're going to get you out of pain. Okay. Second is the corrective care. Once you get out of crisis mode, your body can focus on trying to heal. And next, where the majority of change happens, is after your body is functionally restored and can focus on healing. Okay, so we can reassess after about 30 days to make sure your nerves are actually doing better without interference or stress. Your mobility is better. You're having fewer positives on orthopedic tests. If you're doing your exercises, we should see changes, and within 90 days, most doctors wait years, but we want to do new x-rays in 90 days to stay on top of this, to see how your body is progressing. So that's something that we do very different. So a lot of doctors, unfortunately, go years before taking a new set of films because they're only really looking at gross pathology. They're looking at fractures, at ligamentous instability, or damage that is going to be long-term. Okay, not here. We don't want to play guesswork. We want to make sure you're on task. So it's like wearing braces over time. Okay, so they start making time. We start making time and start with the retainer after we do the initial set of braces. Okay, so that's where we get into the stabilization phase. So stabilization phase is like wearing the retainer. Okay, it takes 18 to 24 months at a time to fully heal the disc issues. Okay, so in that time, we should be seeing you once a week to once a month, varying person to person. Okay. To continue exercises, we stabilize the spine, ligaments, our white tissue there, and there's 10 ligaments to every 2 vertebrae in your spine. So it's going to take some time for all those to heal and to really balance out. So the white tissue has no blood supply, so they're slow healers. For the first 12 months, I want to see you once a week to once a month to make sure that we are making permanent changes, not just helping you get through the initial phase of healing and get you feeling better, but stabilize and function better. So which is the most important phase of healthcare? Stabilization. Okay? If we invest time, energy, and finances after restoring the spine to its normal, it would only make sense to keep it that way, right? So like a person wearing braces and never wearing a retainer, it's not a great idea. That would be kind of silly, right? We spent all this time, let's keep it that way, because things will start to go back to the way they were if we go back to the same habits that brought on that issue in the first place. So you decide what you want to do. I just am here to educate you. That's what a doctor is. It's a teacher. You decide if you're ready to make a more permanent change, and we'll be here with whatever path you decide that you want to go on. Okay. So next steps, talk to Dr. Steve, talk to the doctors at Back to Action to see if you qualify for it, if it makes sense for you to go through this. Choose to make a permanent change with your health. Okay. Be excited and be hopeful about the possibilities, because if you put your energy into this, you're going to see the results. If we just kind of ho-hum go through this, you're not going to see the results that you want to see. So if we're going to be doing the wobble chair, do the wobble chair, put your phone down. If you're going to be doing the exercises, don't be distracted by other things going on. If we focus on our healing, we're going to focus on our healing. Okay, and then share with others. So we ask that you share this. 90% of our patients come here because family or friend told them about us. Your referrals are our greatest compliment. So if you share this information with others and help them heal, you're going to strengthen your community, strengthen the health of our community. So If you have any questions, please share with me. I'm happy to answer whatever questions that may come up. I'm so thankful that you spent this time with us. Sometimes I go a little long-winded, but I'm glad that you guys made it through and that you got some benefit out of this. And we're happy to take care of you in whatever way that looks like. So take care, and we'll talk soon.